Thank you, everyone. I'm really honored to be here. I suppose the reason for why I'm here is, as been mentioned before, we're a specialist in investing in small and medium-sized businesses in general, globally. So we're in 3 continents, and you may have heard we merged with a larger player called Abraj Capital in Dubai, which is currently being integrated. We become the largest emerging market SME player by any standard. We're in 30 countries from Latin America, Africa, Middle East and North Africa now, and Asia, operating out of 30 countries. The reason why we got into the healthcare sector is simply came out of the back of what we were doing in the small and medium businesses. As we were investing in those businesses in East Africa, one of the things that we noticed in our portfolio companies is this constant volatility in expense item for medical care, for workers. And we were trying to figure out why is that? And then we, with the help of the Norwegian government, got a consultant to look into it. And what we found was quite interesting. What we found was there seems to be a big gap between the delivery of medical care, basic care, to the mass market in the marketplace, and hence, and the cost of providing healthcare services to the employees of these companies was exorbitant. And why it's exorbitant? Because the normal insurance policies that we would take in the UK for employees as medical care did not exist. And if it did exist, they were very expensive. Why they were very expensive? Because of fraud. Fraud at the hospital level, where hospitals were charging insurance firms for just about anything and everything and no real audit track. So that prompted us to think through to see how we can help the healthcare sector. So happened at the same time, IFC, the World Bank, and Bill and Melinda Gates Foundation had initiated through McKinsey a study in Africa as to what was the real gap in providing healthcare to the mass market. And they started a 3-pronged approach to address that issue. One was to a World Bank to interact with the governments to change policies on healthcare. 2 was to provide financing in the terms of debt and other sort of capital to these healthcare businesses through banks. And 3rd was to get capital to a typical commercially driven firm to provide risk capital to these small businesses to scale up, because vast majority of the businesses in sub-Saharan Africa in the healthcare was very small, fragmented, hardly enough management expertise, but quite a number of businesses were available, but they were suboptimal. They were not scaling up. So, and they looked around and felt the only way to address this in a meaningful way was to find someone who had an infrastructure in place to provide that capital. Because one of the biggest issues in emerging markets in any business is capital alone does not work. You need to provide human capital, advice, mentoring, and access to scale them up. So brilliant ideas get stuck in the system because the ecosystem is broken. It's not in full. So in order to do that, they came to us, and we had done so much of work in it, so they told us to start. What is unusual about this fund, of any private equity fund on a commercially driven, is that most commercially driven private equity funds are, as Vinay said, are financial return objective based. This is the first fund of its kind that has financial return combined with bottom of the pyramid, BOP targets. BOP targets in the sense the companies you invest in, do they serve the bottom of the pyramid? And if you can, if you as an investor can use your capital to improve in the services they provide to the large mass market, then we as managers would get an upside. So it was a dual objective. And there was always this debate in the philanthropic or social impact or other impact. This question is, do you compromise on your financial return to get the soft targets? And there's always this tension between the two. We've said it right from the beginning, and this goes for any sector, any business. In order to maximize return in emerging markets, you have to reach out to the mass market to get the volumes up. You do not compromise on social, on your commercial return for social objectives. If you get your right models, you achieve both, and you can maximize return. And this was a point that we were quite comfortable. We didn't see it as a dual objective as managers. We felt this one objective. There was this report that what percentage of the population in Africa lived below $2 a day? And if you ask any of my colleagues who live and work in Africa, they'll say 99% of them. But there is debate that maybe 60%, 70%. Well, end of the day, it doesn't really matter. What matters is providing quality service or goods at affordable prices to the mass market is what the end objective was going to be. And also, the point that Julia's slide talked about discovery, development, and delivery. It's a very good point. I would say that we are more on the development and delivery. The biggest shortage in Africa is delivery of services. That's the biggest problem. It's not that you can't grow a company, it's delivering it. The infrastructure is not available. So there's a real challenge to get around that. So grant and investment must sit together. It's not either or the other. Grant must not be mixed up with investment. In other words, when you're building businesses, you only invest in businesses that you can, it is sustainable. It's no point investing in something that's not sustainable. So, but you may be in a stage of the life of the company or the sector or the industry where grant is needed to build the ecosystem around it to make it sustainable. So the investment goes into the business, you use grant funding to build around it, but not to use it to subsidize the investment, because that then beats the purpose of why you are doing what you're doing. So it's a very interesting model. We have got $105 million for Sub-Saharan Africa. It's the largest of its kind. And Kim here is on the advisory board of the fund, where we put together an advisory board of who's who in the healthcare industry around the world, where we're going to try and achieve a couple of things. One is they're the low-hanging fruit. There are businesses available. Get in there, start funding, get them to scale up. Then there is new things that we need, basic stuff that we all are used to. Bring those models from India, China, UK, wherever, and transplant them. We will use grant funding to transplant them into those markets. And people like Kim, who have a huge knowledge in that area, we will leapfrog technology in order to do that. So, mobile phone is a very classic example in Africa. Africa, landline is not the normal phone line, it's the mobile phone. They leapfrogged landline to mobile phone. So using technology to advance and penetrate those markets. We have invested in a company that manufactures syringes. We have invested in a women's hospital on maternity side. We've also invested in a company that does teaching, nursing, diagnostic centers, and hospitals. And in Asia, we have got 5 hospitals around the world in Asia. We're looking to bring some of that technology into Africa. So it's a question of taking the initiatives, the early stage risk, but we're comfortable with the returns as well that will come from that.